Hi there, it's Dr. Suleiman here, Chronic Pain GP, and today's video is about acceptance in chronic pain conditions. So what is the role of acceptance in chronic pain conditions? Well, in today's short video I aim to discuss how greater acceptance of chronic pain can lead to fewer pain-related experiences. The research does suggest that a greater acceptance can lead to less disability, distress, and a improvement in the quality of life. I will add the links to some articles which I've been reading about acceptance and about acceptance commitment theory in the comments box below. So the basic premise of acceptance in chronic pain is trying to move away from controlling the pain and try and focus and concentrate on valued activities and try and complete and achieve specific goals, and these goals are usually very specific and personal to the patient themselves. In essence, it's not about curing the pain, it's about mitigating the effect of the pain and how you can manage pain better. So it could also be described as follows: a process of reducing the influence of thoughts and feelings on our actions instead of trying to change the thoughts and feelings. And often patients accepting chronic pain does not mean giving in to pain. It doesn't mean you can't stop researching new treatments. It does not mean accepting a lifetime of suffering. Along with this, you can still feel angry and sad, can still remain optimistic about the future. Accepting the new reality of the situation that you're in, which could be permanent, is a key feature. And learning to live again in the new reality. It can also help patients become as healthy as possible. And often they do learn the limits of saying no. And the most important thing, I guess, is patients learn that the condition does not define the patient. Now, it feels like I'm doing a bit of injustice to the acceptance and commitment theory in chronic pain because there's literally reams and reams of research on this, some of which I've linked in the comment section. Now, the very core of the acceptance and commitment theory is the ability to have psychological flexibility. Now, psychological flexibility can be defined as the patient having the ability to respond and make changes to their behavior dependent upon the patient's goals and values. Now, this can happen on the background of distracting thoughts and feelings, and the acceptance and commitment theory allows patients not to be hindered by these thoughts and feelings. So the research suggests that there are 6 core processes of psychological flexibility, and they are as follows. Acceptance, and this is essentially saying that we will have pain, but we are willing to carry on with life and all its challenges and goals. Cognitive diffusion, changing or distancing oneself from one's reactions to thoughts, trying not to over-amplify them so they become the only way a person thinks. Having a degree of present moment awareness, essentially saying reflect on the here and now, which is a form of mindfulness. Having the self as a context, which is the ability to adopt a perspective or point of view separate from one's thoughts and feelings. Having values, which are guiding principles in one's own life, and these are distinct from goals and also quite specific to the patient and each individual patient. They're often defined in terms of career, family, intimate relationships, friendships, and health. And the committed action, which is redirecting behavior so flexible and effective action occurs in line with values. So in essence, the 6 core principles are saying that the pain does not define the patient. And above all, the patients do have the ability to function better and enhance their activity. Those patients who respond well to the ACT theory often say to me, for example, my family is the most important thing to me. So I'm going to choose to work really hard with those relationships and try and be the best spouse, partner, perhaps son, daughter, uncle that I need to be. They often go on to describe pastimes and activities they enjoy doing. So they often say, I love going to the cinema. And they go on to describe that they are quite willing to have an element of pain while still enjoying those experiences. Now, patients can often avoid activities which may cause them pain. This is known as fear avoidance. And those patients who have been through ACT therapy can often say, I'm willing to embrace that anxiety and persist with my plans, because I'm aware that in the long term, the activities, whatever they may be, are likely to benefit me and reduce my pain. So in conclusion, the acceptance and commitment theory is a form of cognitive behavior therapy, and in my experience is one of the most useful therapies that pain patients can undertake. Just leads me nicely on to say that the next video will be about treatments in chronic pain. Needless to say that there will be quite a few videos with regards to treatments, and the aim of which is trying to help patients cope and manage their pain better. So it's just enough time to say please remember to subscribe and like the page. Please leave your feedback below and any questions, and I'll try and answer them as soon as possible. And thank you for your time, and see you next week.